how do you tell people in Southington, how do you sort of guarantee them, allay their fear, that their hospital, Bradley, won't suffer the same fate as the carcass here on Cook?
Mm-hmm.
So can we start with that?
Sure.
How do you tell them that the fate of Bradley ultimately is not going to be that Cook Avenue carcass?
That's a great question.
It is.
And we're glad you asked that.
And I guess I would start by saying that, first of all, it's two totally different points in time, and that Bradley has been something that we've been investing in for years. So we see growth in Bradley. We've been putting programs in there. We just invested actually a little over $2 million to retrofit and bring the ORs in that building up to current acceptable standards so that orthopedic surgeons would do their surgery there. So that actually, that opening of the ambulatory surgery center is at the end of this month. So we have physicians who are going to be doing their orthopedic surgery there. So that's one example of investing in. We have a GI suite there that's beautiful, that we are looking to grow, and would like to see more patients utilize that GI suite. We have an emergency department on that campus. What did you give them?
I gave them the investments.
The investments that we put into Bradley.
People do not do that to a facility they are thinking of closing.
Right, exactly. I mean, it is a very important part of our strategy to have services there for the Southington community. The community discussions was to file a certificate of need with OCA to close the beds in Bradley, the inpatient unit, right? Mm-hmm. Of which our census is about 9. So that was the plan. And and OCA asked us to address in that plan what we were going to do with the emergency department. So because we had to file public notice, we had to put that in the public notice. That's what OCA required us to do. And that's when the community conversations began, and when we realized that we needed to pause, because the community was not comfortable with changes in the emergency department, and certainly still had a lot of questions about the inpatient bed, and to what you spoke to, what's really going to happen here. So because that's how we started, that's the information you had, which was correct information, because we were considering moving the emergency department at that time. Never were we ever going to close it, but we have stepped back. We are not filing the for CON. We're going to take the time to communicate with the community, which is what we're doing now, and with all of the stakeholders, and clear up misconceptions or confusions that we may have caused. I think that's a great idea, and we will do that. We're just timing it appropriately, because part of what we're doing at this point, because we stepped back, is to involve the community. So we do have a community advisory committee. It's made up of leadership from the Southington community as well as citizens of the community, and we're in the process, and Trish is leading that, to begin to get their input and have them react to some of our thoughts and our ideas. Because we have had some, the interesting thing is our world is changing in healthcare so quickly that we had some thoughts and ideas that we will bring forward, but there's some new and innovative things that are happening that we want to bring into the mix as well. So, to make the long story short, we're in the process of doing that. We want the community to be involved. We want to have some engagement and involvement, so that when we do that, we're at least a part way through of having that vision which was created together.
Was that a mistake then to move forward with some of the changes that you made, reduction in patient beds and the plan to?
I think certainly
the idea of moving the ER without getting that community engagement ahead of time.
What do you think? She wants to talk.
We definitely want to include the community, but at the same time, and we did apologize, and that was an important apology to make, but we're really proud about what we want to build.
Is that people who need care have been finding care. Mm-hmm. And what we found is that as utilization has gone down in that particular building, it becomes more difficult to give the mix of services and the depth and breadth of things that a person comes into a hospital and needs. So
the model of a full service hospital just doesn't work
on
at
that
Bradley
scale. Ongoing viability and transition, decreasing 1999 from the Department of Public Health. Decreasing patient volumes and declining reimbursement make the hospital's viability tenuous.
Was there consideration of putting the family health center at Bradley?
Well, the issue is about how do we provide multiple points of access for the community. And so the mix of services and where they're going to be has not been decided yet. But we believe that if we can give a family health center to one part located in one place, and our Bradley Hospital use that facility at that location, we could access more patients.
And help more
Make it
patients.
more,
And that's the
more
goal.
convenient. And
Is part of it too that Queen Street area is just more convenient for for that whole side of town of Southington, and the access to 84 is right there. Does that play into it at all, or is it?
we look where people work, where they shop, where they go. Just think about it, to make it easy for them and convenient to access. And that street is pretty well known as being one that everyone travels there. So yes, I mean, it's considered a very good location. At the same time, downtown Southington is the quaintest little town, is also a very good location. So that's why we're looking at both for kind of different markets.
And we would be committed to both. And and we'll do traffic studies, because that was an important thing that came up at the community meeting. That was important.
Right.
You know, is the sort of the thing that's replacing it the family health center? Is there a reduction in services there?
We're at the Family Health Center.
No, that was the concern.
And you know what, I think that's a
Or-
really good point. I think that you're right, and I think that because we knew, because Hartford Healthcare knew that it wanted Bradley, it didn't see it as a reduction. Does that make sense? And that was a mistake, to not see the perception. We didn't see the dismantling because we knew we want to invest. We knew how much we believe in Bradley Hospital. When people say save Bradley, that's what we're trying to do. That's us. That we are the biggest advocates of Bradley campus. We are.
It's a tremendous asset, and it means a lot to the community. And I live there. I know what tradition means in Southington. So, you know, to when we heard the sentiment of the people, it was really, hey, you know, it could be 50% over there, over here. If this is where people really want it, we can solve for the needs of Southington in a different way.
It was about listening, and it really was about, and we didn't see that because it wasn't in our, does that make sense? It wasn't in our sights, so we didn't anticipate that.
Is the money being used in the Bradley Barnes endowment to purchase equipment? Where is that equipment going? Where is it gone? Is it going to end up back at Bradley?
That's a great question. We heard that a lot.
Yeah, and the Main Street Foundation is the trust that oversees that. And we have articulated and worked with Main Street on every single piece of equipment that they've given to Bradley since '06, which is when Hospital Central Connecticut and Bradley merged. And we have identified every single piece of equipment is still in Bradley, except one piece of equipment, which was moved to New Britain. And that was because it was used specifically for surgical patients, the kind of surgery that's no longer done on the Bradley campus.
Okay.
Everything else is still at Bradley, and Main Street Foundation is very comfortable with that.
Okay.
So we answered those questions.
You've made a number of changes. For example, the operating room, replacing it with the ambulatory surgery. It seems like you have an idea of what you want to do, and at the same time, you're going through you've applied for a planning grant, and why not let that process play out before making these changes?
Well, nothing stays in time. If we could just freeze everything and do that, it probably would be make a lot more sense to everyone. But as we're moving along, we know this facility is an asset. We know it's going to be ambulatory services. I mean, we're not putting inpatient services in Bradley. We already have them there. It's not working. So as we are working with physicians and some of the needs that we see, it's just a great facility and a location to be able to use. Having said that, we have a lot of empty space in that building. So we really do need to do more planning, and we're looking for some innovative and creative thoughts that we hope we're going to find from really benchmark projects around the country. And that's really what Tricia's heading up, is really that whole innovative piece. So we can't just stand still, because then I'm afraid we would lose opportunities. And it's just being
You also,
viable.
you have to think about
yeah,
volume
staying
and,
afloat.
you know, and how the healthcare landscape has changed. And if more people are getting surgeries in outpatient ambulatory settings, fewer people are being admitted to the hospital, fewer people were coming to Bradley. And I saw that happen since, as Rebecca was saying, the 1990s. So at some point you have to say, do we keep an operating room operating when we have very few cases? Can you maintain the quality? Does it make sense to continue to do that? You have to be concerned about quality and where volume is. You can't have a full service hospital everywhere. Maternity was at Bradley years and years ago, and that was taken out because they didn't have enough births.
Every bit of it is utilized.
Oh,
Just
yes.
bustle, just it's fully utilized
Yes.
in a wide variety of ways.
Yes.
Correct.
And it has
I would
a
be
very
very happy.
long-term
Yes.
future in
Yes.
your view.
And we are actually expecting, when we looked around the country and did research, we're expecting that people are going to be coming from other healthcare delivery systems around the country are trying to solve the same problems and say, what did they do at
We
Bradley?
would like to be
This is
model.
Hartford
Yeah.
Healthcare.
Yeah.
We want to be the innovative model that other people are coming out and saying, wow.
That's why we were saying we need to do a better job of saying we have a great vision, we're working on it, but we're really proud and we are excited. This is an exciting time for the community because you'll be on the cutting edge of what we want the future of healthcare to be.